Comfort too for a widower. His wife's legacy means other stroke victims may get vital treatment before it's too late.
I'm delighted, absolutely delighted by what's been achieved, and I'm delighted that Barbara's memory is honoured by this conference.
Derek Whitehead had to watch his active, talented wife become paralysed and unable to speak after suffering a stroke. Back then, it took 16 weeks for Barbara to be diagnosed. Derek from Cheadle has since campaigned tirelessly for stroke patients to get faster, life-saving treatment, and today he saw that dream realised.
Anyone showing symptoms of a stroke in Greater Manchester will now be taken to one of 3 specialist centres. It's the first area in the country to try the new method. Abby Jones reports.
It was on a round-the-world trip that Barbara Whitehead had her first stroke. A woman who lived life to the full and loved painting, she became completely paralysed and unable to communicate.
For a woman of her talent to be damaged in such a way is disastrous. It's heartbreaking.
When a stroke strikes, it spreads like a fire in the brain.
As this advert shows, a stroke can destroy brain cells with devastating speed. Immediate treatment is vital. Barbara Whitehead went weeks before a diagnosis. That was the norm. Today, drugs can help prevent more damage, but there's only a 4.5-hour window. A scan is needed, fast, to find out if patients are suitable for the drugs. Going through casualty at local hospitals can take time they don't have. Now in Greater Manchester, ambulances take patients straight to centres like this one at Salford Royal Hospital.
We're already seeing many more patients getting the clot-busting treatment because they come much earlier. In Salford, we're seeing many more patients coming through. They're coming through much more quickly than they were even a year ago.
As well as Salford, there are acute stroke centres in Bury and Stockport, and 4 district centres for ongoing care. Palmer Thompson from Bury knows just how important quick treatment is. She had a stroke a year ago.
The blood had gone in the brain and that would have been it. She'd have been disabled, really disabled then. So,
I'm very lucky.
Essential.
Very lucky.
No doubt about it.
Derek Whitehead explained the new scheme to NHS staff today. His persistence in his wife's memory for thousands of other sufferers has finally paid off.
And that was an uphill struggle. I was a voice in the wilderness. I'm delighted, absolutely delighted by what's been achieved, and I'm delighted that Barbara's memory is honoured by this conference.
Abby Jones, BBC North West Tonight.
Well, I'm joined now by Dr. Peter Elton, Director of the Bury Primary Care Trust and leader of Stroke for Greater Manchester. So, Doctor, we heard Derek Whitehead there, and he's campaigned for some time for this, and the drug's been available for several years. Why hasn't this happened earlier?
You've got to remember that stroke was never considered a medical emergency. We used to think at that time you had to give the drug within 3 hours, and it was a major change the way people thought, both the public about presenting themselves earlier and about the doctors reacting quickly. It was a major change in the way we thought.
So, for the drug to be effective, it has to be used, within around 4 hours?
We now know that it's up to 4.5 hours, so you've got to be in the hospital really within 4 hours to have a chance.
So these new specialist centres presumably are hugely important to get the maximum effect from the drug?
Yes, because the staff are waiting, and what we've got to remember, even within that 4 hours, the earlier you have the treatment, the better your outcome.
And the scanners, just explain that to me, because in these centres, CT scanners are going to be on 24 hours a day, and is this just for stroke victims?
So I hope they're going to be available 24 hours a day, and we have these 2 other centres, so during rush hour you can get to those centres quicker, and they're going to be available all the time, so you go straight into the CT scan as soon as a stroke is diagnosed, and you can make sure that there's not a bleeding stroke, because if you give this drug to somebody who's got a bleed, that will make matters worse.
And the drug we're talking about, which you said is 4.5 hours, it needs to be used after the stroke has happened. The earlier it's used, the better. What exactly is it doing?
Well, it basically dissolves the clot. So it allows the blood to go back into the brain. So at the moment you've got blockage, it clears the blockage, and you get blood coming back into the blood supply going back to the brain.
So presumably the key to all this is immediate diagnosis of a stroke if you're going to get the maximum benefit from all this?
Yes, so it's sometimes very difficult when you first have symptoms knowing it's a stroke. So if you're in doubt, people must go to the hospital straight away, or the carer must ring the hospital straight away. You get an ambulance, the ambulance regards as an absolute emergency, and they will take you to one of those 3 sites.
Right. And are you able to very briefly say what the immediate symptoms are?
Yes, so it's a weakness in the face, down one side usually, weakness in the arms, speech becoming slurred. Those are 3 key symptoms.
Right. Well, all this, of course, is great news for Greater Manchester, for people who are suffering from strokes. But one wonders about people in the rest of the region who are suffering from a stroke. Is this going to be another sort of example of a postcode lottery, that it's good for you in Greater Manchester but not anywhere else?
Well, there always has to be someone that goes first. But yes, we're very pleased. London are copying what Manchester are doing. We heard that the West Midlands were as well. Lancashire have got plans. They'll have to be slightly differently because the distances are wider. But yes, other people will follow where we've led.
Okay, Dr. Peter Elton, thank you very much indeed for joining us.
Thank you.
Thank you.